All right, today we're going to dive into a really fascinating idea from Dr. Patricia Aybar Morera. It's all about connecting two worlds you'd probably never think to put together: the intense pressure of public speaking and the high-stakes life or death world of clinical decision-making.
So let's set the scene here. On one side, you've got a speaker, right in the middle of their groove on stage. And then, bam! A hand shoots up with a super tough, out-of-left-field question. Then, on the other side, picture an ER. It's kind of calm, just the steady beeping of monitors. And then all of that is just shattered by a blaring alarm. A patient has suddenly collapsed. I mean, on the surface, these two things couldn't be more different, right? One feels like a war of words, the other is literally a battle for a person's life. But what if they aren't so different after all? What if the core skill you need to master both situations is exactly the same? Well, that's what we're digging into. It turns out there's one massive challenge that links these two worlds: intense, high-stakes pressure. Both of these scenarios demand a mind that can perform at its absolute peak when everything, and I mean everything, is on the line. And what makes this whole idea so compelling is who it's coming from. Dr. Aybar Morera has actually lived it. She spent a decade coaching public speaking while also going through medical school. And in her own words, she found that the one thing at the heart of both was this incredible ability to think clearly when the pressure is on. Okay, so thinking under pressure. That's a great phrase, but what does it really mean? It's way more than just, staying calm or not panicking. It's a very specific and actually trainable set of skills. So let's break it down. It's really about four key things happening all at once. First, you've got this flood of new information coming at you, and you have to organize it, like instantly. Second, you have to keep your composure, not letting your own stress get in the way of good judgment. Third, you've got to be able to adapt to whatever crazy thing just happened. And finally, number 4, you have to communicate your plan clearly, whether that's to an audience or to your medical team. Let's zoom in on that last piece for a second: communication. Because in medicine, this isn't just a nice-to-have skill. It is an absolute lifeline. It can literally be the thing that decides whether a patient has a good outcome or a bad one. And look, this isn't just some feel-good theory. We're talking about something that's actually backed by solid research. There's real evidence that shows when doctors are better communicators, their patients get healthier. Period. Take this study from 2014 in Iran. Researchers basically put this to the test. They took a group of doctors and gave them special training workshops on oral communication, pretty much the same skills a great public speaker would learn. Now, the first result wasn't a huge surprise. The doctors got way better at talking to their patients. But that's not the amazing part. This is where it gets really incredible. The patients of those trained doctors, they actually got healthier. I mean, look at this. They had better control over their high blood pressure, they were much better about taking their medicine correctly, and they just felt more confident in managing their own health. Good, clear communication literally led to better health outcomes. But hold on, it gets even deeper. The benefits of this kind of training, they go way beyond just being a good communicator. We're talking about forging some serious cognitive strengths that are absolutely critical when the pressure is on in a medical setting. Think about it. The whole process of prepping for and delivering a speech, of having to think on your feet, it's like taking your brain to the gym. It's a workout for the exact same mental muscles a doctor needs in the middle of a crisis. So what are we talking about here? Well, for starters, there's planning and organization. Then there's something called social cognition, which is really just a fancy way of saying you can read the room, whether that room is a lecture hall or an exam room with a single patient. And third, it builds that raw ability to adapt when things get chaotic and unpredictable. So here's the bottom line: the direct connection. You've got the speaker's brain, right? It gets hit with a tough question, and boom, it has to instantly sift through everything it knows to build a coherent answer on the fly. Now look at the clinician's brain. It's doing the exact same thing. It's taking in symptoms, lab results, patient history, and making a split-second, life-saving decision. It is the same mental muscle, just playing out in a different stadium. Okay, so when you put all of this together, the communication, the organization, the adaptability, it all points to one ultimate master skill that ties everything together. And that skill is mental flexibility. I mean, a truly great speaker isn't just reciting a script, they're constantly adjusting to the audience's reactions and energy. And a great clinician, they have to be ready to throw out their entire treatment plan in a heartbeat the second a new lab result comes back or a patient's condition changes.
It's all about that ability to pivot, to not get so locked into your first idea that you miss what's actually happening. And that really leaves us with one big question to chew on. If the skills you learn in a public speaking course could actually help a doctor save a life, it really makes you think, doesn't it? So, what's some seemingly unrelated skill in your own life that, if you really dedicated yourself to it, could completely change the game for you at work?